Today is the second part of this vectors for the vector-borne diseases. So আগের দিন কি পড়েছিলাম? What did we learn last class? Culex and Aedes, তাই তো? Culex and Aedes. So today we will start with the Anopheles, okay, and then move on to other vector-borne diseases. What is this map? এই যে ব্লু, then pink, red এইসব জোনে ভাগ করা আছে. What is this showing? What distribution is this showing? It is showing number 1 যে API, annual parasitological index, তাই তো? Number 1, the color coding is based on that. Number 2, it is also showing the distribution. Why? Because there is different Anopheles species causing diseases in different parts of India. For example, ki a rural plains or peri-urban transmission, this area seasonal hypoendemic. Seasonal hoy mane jokhon borshakaler pore around that time hoy, it is caused by Anopheles culicifacis. Anopheles culicifacis. It is the most common Anopheles mosquito যেটা rural area তে usually হয় or peri-urban areas এ হয়. It is seasonal. It increases, the vector count increases during certain seasons like after rain and then decreases again. আর কি আছে? Major malaria কি ছড়ায়? Falciparum, vivax. Okay. Then what is this red zone? This red zone is around Jharkhand, Odisha, red zone. The ecology is what? Tribal forest, tropical areas. Okay. What are the mosquitoes that are present there? There is not Anopheles culicifacis, it is Anopheles fluviatilis. And it mainly causes what? Falciparum type of malaria. Okay. So in these jungle areas, the tribal forest areas is where the highest falciparum is spread. Vivax এর থেকে এখানে falciparum বেশি spread হয়. So it's a severe form of malaria occurred here. Again, in the southern India and in some parts there, the ecology is mainly urban or slum area, and here in the urban areas the major vector is Anopheles stephensi. In the urban areas it is Anopheles stephensi. Okay, and major malaria species is Plasmodium vivax. So in this way the vectors are distributed across India. There are many other vectors that are distributed throughout India, and that is causing the malaria, and it also the malaria parasite species is also differing from place to place. Understood? So this is the current spread of the disease in India, and the color coding is showing the severity of the API, that is how much density is the parasite present, with how much density is the parasite present. So now we go to the Anopheles mosquito. You do not have a specimen of Anopheles mosquito for your exam, okay, because you have already have Culex and Aedes, ওগুলো থেকেই বেশি আসবে, কিন্তু Anopheles টা তোমার different কি সেটা জানতে হবে, because questions can come related to it, right? So firstly, what are you noticing Anopheles এ বলো আরো কেউ বলো, Anopheles মশাটা Culex আর Aedes থেকে কি করে আলাদা? প্রথমেই দেখে কি মনে হচ্ছে? Slanting, না? It is a slanting, the body is straight, there is no hunchback, তাই তো? There is no hunchback. So the body is straight and sitting on the surface, so body is slanted on the surface, it is not parallel to the surface. Number 1. Okay. Number 2, it has spotted wings, it makes no buzzing sound, it is inclined at an angle of around 45 degrees to the surface, it causes malaria. In India, Anopheles causes malaria. Okay. And যেহেতু এভাবে 45 degree rest angle এ করে to the body, so that is why palpi are as long as the proboscis. In females also. In females also, the palpi are as long as the proboscis. Because what happens is, যখন এই সারফেসে বসে, when it sits on the surface, it needs what? Proboscisটাকে সাপোর্ট দেওয়ার জন্য the palpi also need to be as long as the proboscis. Because it is sitting slanting to the surface. It cannot penetrate perpendicularly. Right? So it needs to support. That is why you can remember like this, since the Anopheles mosquito slants on the surface, so the palpi should be long as the proboscis. It is not shorter than the proboscis in females also. Understood? So Anopheles, the males have, what is the difference between a male and a female? The males have bulbs at the tip of this palpi, females do not have bulbs. For example, in this you can see this is a female, this is a male. The female papilla are, the palps are the normal, maxillary palps are the normal. They are as long as the proboscis, but they do not have any swelling or bulbs at the tip of the palps. And here you can see in the male there is bulb at the tip of the maxillary palpi. Okay? Ekhane antenna ta again non-bushy, and in males it is bushy. So this is how you identify a Anopheles specimen. Okay? Anopheles specimen. So this was the Anopheles vectors that are there. Eta tomader boite acho, tumra poreocho age. Okay? But how is it distributed? They are usually distributed major jeta Anopheles mosquitoes are present in India. They are Anopheles culicifacis. Anopheles culicifacis, because majorly India has a rural and peri-urban landscape. That is why the Anopheles culicifacis is also widespread, most present in India in these areas only, in the rural and the peri-urban areas. Okay? Then comes the urban area. Urban area te ki ache? Anopheles stephensi. Okay? Particularly in the coastal region, and they prefer what? They prefer small collection of clean water, prefer human dwelling cattle sheds. যেখানে একটা human activity আছে, the Anopheles stephensi mosquito are mainly present there. Then when in the tribal forest, as you saw, there is the Anopheles fluviatilis. Anopheles fluviatilis. It is in the forest plains and foothills, seepage and in irrigation channels. আর তিনটে কি আছে ইন্ডিয়াতে? Anopheles minimus, যেটা নর্থ পার্ট অফ ওয়েস্ট বেঙ্গল, নর্থ ইস্টার্ন স্টেটসে পাওয়া যায়, প্লেন্স বলো হিলস বলো যেখানেও, সেখানে Anopheles minimus পাওয়া যায়. Anopheles dirus is present in the deep forest in the northeastern region of India, and Anopheles sondaicus, it is present mainly in the Andaman and Nicobar Islands. So these are the 6 species of mosquito, of Anopheles mosquito, that are present throughout India, and not every vector causes every form of malaria. More or less kore they are spreading the malaria parasite. এই ছটার নাম মনে রাখতে হবে, বিকজ এটার উপর তোমাদের শর্ট নোট আসতে পারে যে how many types of Anopheles or vectors of malaria are there. So Anopheles culicifacis, stephensi, then fluviatilis, these are the main 3 types. Then comes Anopheles minimus and Anopheles dirus and sondaicus. Okay? Egulated distribution, this is another map that is showing the distribution of these mosquitoes, but you already read that, nothing new here. Now this is the parasite. কি প্যারাসাইট আছে ম্যালেরিয়া, এটাও তোমরা পড়েছো. ওকে? কি আছে? falciparum আছে, or else cause tropical malaria. It is present in all endemic areas. It is very serious and causes death if not treated quickly and effectively. Okay? Then vivax আছে, and then there is malaria. এই তিনটে ইন্ডিয়াতে পাওয়া যায়. Right? falciparum, vivax and malaria. ওভেল আর নোলেসিটা ইউজুয়ালি এখানে পাওয়া যায় না, আফ্রিকা বা অন্যান্য জায়গায় পাওয়া যায়. In Asia or in India, what is there? That is falciparum, vivax and malaria. So which is more severe? কোন প্যারাসাইটটা more severely causes malaria? falciparum. Very good. তারপরে হচ্ছে vivax, তারপরে হচ্ছে malaria. Okay? Life cycle of Plasmodium malaria resembles, I think, falciparum and ovalটা বোধহয় vivax কে resemble করে. It is the life cycle of the parasites are like that. But mainly you have to know about the falciparum, etar management, how to manage the falciparum malaria and how to manage the vivax malaria, যেটার question এসেছিল তোমাদের আগের internal assessment এ, তাই তো? Now what are the habits of this Anopheles mosquito? Anopheles mosquito feeding habit হচ্ছে again anthropophilic and zoophilic. It can feast on both animal blood and human blood. A blood meal on the part of the female Anopheles is essential for the maturation of the ovum. Biting time, endophagic. Endophagic throughout evening and early part of night. Again, evening and night, this Anopheles mosquito bites and it is biting inside the home, that is endophagic. Resting habit, again endophilic. Indoor resting habit, kothay kothay? Because in the human dwellings, বাড়ির মধ্যে কি cattle shed এর মধ্যে indoorly, not in the outside jungle, they are usually residing indoors wherever there is a little bit of human activity so that they can feast on the animal or the human blood for maturation of their ovum. Okay, so their resting habit is again endophilic. Breeding places, it prefers clean water. Now what type of clean water? Irrigation channel, river bed, ponds, pools, lakes, spring, brackish water, burrow pit, fruit vegetable garden, well open overhead tanks and or in well cistern, মানে সব রকমই যেখানে clean water পাওয়া যায় সেখানে. এবারে depending on the species of the Anopheles, the place of breeding differs. Like if you are finding it in rural and peri-urban areas, you will find them in moving water, mainly in streams, okay, then lakes, in those areas. যদি তুমি Anopheles stephensi বলো urban area, then they will prefer clean accumulated water. Okay, but they মুদ্রা কথা হচ্ছে they prefer clean water. They do not lay eggs in dirty water, and they can cover a long distance range, about 1 to 3 kilometers. Okay, understood about the habits till now? These are some of the breeding habits of Anopheles dam, barrage, এসব জায়গায়. Okay, Anopheles mosquito are usually found. This is again another map of the states that are endemic, that used to be endemic in malaria. এখানে এটা 2016 এ এটা ছিল, যেখানে red দেখছো that means it is highly endemic, the API is very high, and again the API has decreased in 2019. The endemic districts have lessened in number. এখানে যতগুলো endemic district ছিল এখন অনেকটা low হয়ে গেছে. So this is how the management in the public health level of malaria is done, not only in the treatment part but also what are screening, detection, ঘরে ঘরে active case finding করে they are targeting the areas which have high API, and then they are preventing the transmission of malaria by doing what? কি করে malaria prevent করছে? They can do environmental modification, they can do biological control, they can do chemical control of mosquitoes. যেমন API যেখানে যেখানে হাই বা লো সেই অনুযায়ী ফোকাসড ম্যানেজমেন্ট করে দি endemicity of the area to malaria has been lessened. So how to lessen this endemicity, how to lessen this transmission? We have to monitor something, right? Monitor করতে হবে যে কত ম্যালেরিয়া ছড়াচ্ছে. How do we monitor it? By API, annual parasite index. So it is a number of confirmed new cases of malaria in a specific year expressed per 1000 individuals under surveillance for a given territory, country or geographic area. কতগুলো নিউ কেস অফ ম্যালেরিয়া রেজিস্টার হয়েছে? API 0 মানে category 0, so there is no malaria at present, but we have to prevent re-establishment of malaria again in the area. API less than 1 for all districts in the state means category 1 elimination phase. So it is undergoing elimination phase, means malaria has been in the process of elimination. API less than 1 for state but more than 1 in some districts, then it is category 2 pre-elimination phase. And API more than 1 in the state itself, it is category 3 intensified control phase. So depending on this, the states and the districts have been divided according to API, and district wise actually the management has been intensified or there is prevention of re-establishment. ওকে, এখন ম্যালেরিয়ার এন্ডেমিসিটি আগে যেমন ছিল অতটা নেই, নাও ইট ইজ জাস্ট কনসেন্ট্রেটেড ইন সার্টেন পার্টস অফ ইন্ডিয়া, লাইক মেনলি ইন দি ট্রপিক্যাল জঙ্গলস and the northeast forest. Okay, mainly in these regions only the malaria is now present, is endemic. In the rest of the areas of the India, the endemicity has been decreased significantly. Okay, then there is the annual blood examination rate. Annual blood examination rate দিয়ে কি করে হয়, মানে তোমার যতজনে ব্লাড কালেক্ট করছো তাদের মধ্যে কতজনের কি প্যারাসাইট, বলো অ্যানুয়াল ব্লাড এক্সামিনেশন রেট কি, বলো পড়েছো তো? হ্যাঁ, আর স্লাইড পজিটিভিটি রেট, কতগুলো স্লাইড এক্সামিন করেছে তার মধ্যে কতগুলো পজিটিভ এসছে। ওকে, so API, ABER and SPR, these are the three measures. These can also come again in exam, that what are the measures of maybe monitoring or how to detect malaria. Okay, what are the methods of detection of malaria, কি করে কি টেস্ট করা যেতে পারে apart from microscopy, and then you are doing nowadays what, rapid diagnostic test. Okay, apart from that, what are all the tests that can be done to understand the endemicity in a region. Again, the eggs of the Anopheles, their eggs are laid singly, they are boat shaped and they have lateral floats. এই যে এই পার্টটা দেখছো, again that is a lateral floats, it is helping them to float on the moving water or on the water, যেটা আগে কিউলেক্স আর এডিস মসকিটোজ এর এগসে ছিল না। This is the difference in the eggs of the Anopheles mosquito. And then larva, again you can see it is different from the Aedes and the Culex larva. What is the difference, বলো পড়ো, তোমরা পড়ো কি লেখা আছে, surface feeder, তাই তো? So the head is at the surface, head is not down, so it is not a bottom feeder, it is a surface feeder, it can eat food from the surface only. It floats horizontally just below the surface, very active with swift movement. It doesn't have any siphon tube, যেহেতু মাথাটাই ওপরে বা পুরো বডিটাই ওপরে, so they do not need any another separate respiratory tube or siphon tube. So how do they breathe? They breathe by pores throughout their abdomen, throughout their bodies. Breathing apparatus consists of parallel air tubes at the tail end. এখানে parallel air tube আছে পুরো বডিতেও তোমার, there are ways to keep breathing. So they do not have any siphon tube in the Anopheles larva. তাহলে বলো এটা কি, what is this head, what is this mosquito? This is the head part of the mosquito, right? This is the head part. তাহলে বলো Anopheles, what Anopheles, মেল না ফিমেল? মেল Anopheles mosquito, তাহলে বলতে হবে মেল Anopheles mosquito. The answer is male Anopheles mosquito. Why? কেন male Anopheles? Antenna are bushy and at the tip of the palpi there are bulbs, তাই তো? There are bulbs. Tip of the palpi তে এই যে পার্টটা দেখছো, there are bulbs. So it is male Anopheles. তাহলে এটা কি female Anopheles, কেন? ঠিক আছে, হ্যাঁ bulbs নেই palpi-তে, they are long as the proboscis and the antenna is non-bushy. Antenna non-bushy মানে female mosquito, তাহলে কোন female mosquito হবে এটা, যার palpi same as the proboscis, that is Anopheles only, and you can also see that there are no bulbs at the end. So this is how you identify the female Anopheles mosquito. So these are the diseases that are transmitted by mosquitoes. Anopheles causes malaria in India. Culex causes Bancroftian filariasis, Japanese encephalitis, West Nile fever. Aedes কি কজ করে? ডেঙ্গু, ইয়েলো ফিভার, চিকেনগুনিয়া, জিকা, রিফট ভ্যালি ফিভার, অ্যান্ড যেগুলো নট ইন ইন্ডিয়া লেখা আছে, ইন্ডিয়াতে এই মশা কজ করে না। ইন ইন্ডিয়া only Culex causes filariasis. Understood? So whatever question will come in your exam, it is all related to Indian scenario. because other countries, other scenarios onnanno vectors, they are causing other diseases also which are not there in India, right? So this is the mosquitoes. Now how to manage these vectors, এটা একটা জাস্ট ওভারভিউ দিচ্ছি, এটা তোমরা পড়েছো, আলাদা করে কিছু বলার নেই, বাট ইন দিস পিকচার অনলি দেয়ার আর all the methods that is there. That is environmental management. Environmentally আমি কোথাও জলাজমি সেগুলোকে বুঝে দিচ্ছি, okay, we are clearing out the water accumulation. Chemical larviciding, we are spreading larvicides, chemical larvicides. We are also using larvivorous fish which are biological agents, এটা larva হলো. Then outdoor fogging, and then there is a long lasting insecticidal net and indoor residual spray for the adult mosquito. So in this one picture only there is the কি বলে এটাকে বলো, বাকিরা বলো, what is this management called for vector-borne disease? Integrated vector management, integrated vector management, IVM. The management of vector-borne disease, যদি কোশ্চেন আসে প্রথমেই তোমাদের লাইন লিখতে হবে, we do it by integrated vector management. Then you have to describe the different methods of integrated vector management. Why integrated vector management? এই নামটা কেন দেওয়া হয়েছে? অনেক রকম মেথডস একসাথে আমরা ইউজ করছি, টার্গেটিং অ্যাডাল্ট মসকিটো, টার্গেটিং লার্ভিসাইডস, টার্গেটিং এগস, অ্যান্ড টার্গেটিং দি এনভায়রনমেন্ট অলসো ইন which they are breeding. So we are doing it in an integrated way. So that is why it is called integrated vector management. So this is just an overview of this. Chemical control হয়, biological control হয়, environmental control হয়. Chemical control কি করা হয়? IRS, indoor residual spray দিয়ে হয়, space spraying হয়, larval source management মানে larvicides, and long lasting insecticidal nets. Biological control কি দিয়ে হয়? Gambusia fish দিয়ে, আর biolarvicides like in bacillus, some form of bacteria are there. And then there is the environmental management. How? By source reduction, modification of breeding sites, solid waste management, improved housing design. In this way you are doing the environmental modification or as well to prevent the vector-borne disease. এটা তোমাদের দিয়ে দেব, পিপিটিটা পড়ে নেবে, but I'm not elaborating it, you already know. But when a question will come about IVM, you have to write in this way, like in this fashion, in these steps, যে chemically আমরা কি কি করব, biologically কি কি করব, and environmental modification কি কি করব, আলাদা করে সেগ্রেগেশন করে লিখবে, নাহলে কিন্তু সব জগা খিচুড়ি পাখি দিলে কিন্তু দ্যাট ইজ নট আ ভেরি গুড অ্যান্সার, মার্কস কমে যায়। যত অ্যারেঞ্জ করে লিখবে দ্য মার্কস উইল ইনক্রিজ। ওকে, সো ইফ ইউ অ্যারেঞ্জ ইট লাইক দিস, ইন দিস ওয়ে, দেন ইউ উইল গেট গুড মার্কস। আইভিএমটা কিন্তু এভাবেই লিখতে হবে। ওকে, now what are the other vectors that are causing this vector-borne disease? Mosquitoes হলো, আর কি কি ভেক্টরস থাকতে পারে যেটা ডিজিজ করতে পারে? হাউস ফ্লাই, হাউস ফ্লাই কি করে পড়ো, এভরিওয়ান রিড। টাইফয়েড, কলেরা, ডায়রিয়া and dysentery, poliomyelitis, gastroenteritis আর trachoma. So housefly can transmit these diseases because they transmit by fecal-oral route. So housefly is a vector in that transmission. Then there is a itch mite which causes scabies. Very good. Cyclops or the guinea worm disease. Then there is a sandfly causing কালাজার। আরেকটা নাম কি কালাজারের? লিশম্যানিয়াসিস। ভেরি গুড। সেটসে ফ্লাই হচ্ছে স্লিপিং সিকনেস। লাউস হচ্ছে এন্ডেমিক টাইফাস। র্যাট ফ্লি, র্যাট ফ্লি কি কজ করে? র্যাট ফ্লি, র্যাট ফ্লি প্লেগ, তাই তো? রেডুভিক বাগ, চাগাস ডিজিজ। হার্ট টিক কজেস tick typhus, KFD, Cashanur forest disease, viral encephalitis and many other disease. Soft tick causes only relapsing fever in humans. Okay, so these are other vectors which cause these diseases. MCQ আসতে পারে, তাই তো? So এগুলো মনে রাখতে হবে, but in a little details we will go through some of these vectors that I have highlighted, that is sandfly, hardtick and softtick. So sandfly, why? Because it is endemic in certain states in India. আগে ওয়েস্ট বেঙ্গলে এন্ডেমিক ছিল, এখন আর নেই। So this sandfly is Phlebotomus argenteis, Phlebotomus papatasi, Phlebotomus sargenti. Is it a mosquito or not? Mosquito moto dekhte, is it a mosquito or not? It is not a mosquito, right? It is a type of fly. It is a special type of vector, that is sand fly. কি ডিজিজ করে? এটা লিশম্যানিয়াসিস করতে পারে, ওরিয়েন্টাল সোর করতে পারে, কিউটেনিয়াস লিশম্যানিয়াসিস, দিস ইজ ভিসেরাল লিশম্যানিয়াসিস, তাই তো? Then there is cutaneous leishmaniasis, Oroya fever, sandfly fever. So all these diseases can be caused by sandfly. কি parts আছে? এটা head আছে, pair of long hairy antenna, palpi and proboscis, thorax, a pair of wings. Wings are upright, as you can see, lanceolate in shape and densely hairy. Then there are three pairs of legs which are strong and slender and out of proportion to the size of the body. Means the legs are very much longer than the body length. And the abdomen is in the female, the tip is rounded. In the male, there are claspers. So this is what a sandfly looks like. It kind of looks like a mosquito, but it is not a mosquito. Okay? It also takes blood meal, like mosquitoes. So কোথায় কোথায় থাকতে পারে? What are the resting and breeding places? This is a study that was done around the epidemiology of sandfly diseases. So where did they find sandfly? In animal burrow, banana bush, brick pile, যা যা ছবি দেখছো যেখানে যেখানে cattle shed, okay, coconut tree shells, buttress root, wall crevice, tree hole, firewood stock, মানে যেখানে যেখানে তোমার হিউম্যান অ্যাক্টিভিটিস থাকতে পারে, এখানে cracks and crevice, even আমরা যে বলি যে কাঁচা বাড়ি, ঠিক আছে, বা ইট গাঁথা বাড়ি, যেগুলো পুরোপুরি পাক্কা বাড়ি নয়, সিমেন্ট দেওয়া হয়নি, সেগুলোতে কি হতে পারে? স্যান্ডফ্লাই ক্যান ব্রিড ইনসাইড দেম ইন দিস ক্র্যাকস. So there is a high chance of vector-borne diseases if you have those type of houses in endemic areas. Okay, there is a high chance of having that breeding place for the sandfly, and there is a high chance of the disease occurring, especially visceral leishmaniasis. Okay. So it mainly requires a hot humid climate with cool shaded areas. Climate টা hot and humid হতে হবে, but they prefer cool shaded areas যেখানে মানে crevice বা wall cracks এর মধ্যে ওরা ওখানে breed করবে বা rest করবে. So this is where the sandfly is present. What are the habits? It is usually zoophilic. Peak time around midnight. Bite is irritating and painful, and it cannot usually fly, but it hops. Sandfly cannot fly, it has a hopping habit. একসাথে 50 yards of breeding places এর বেশি বাইরে যেতে পারে না. So it is density বা spread টা অনেকটা কম. The spread is much lesser than mosquitoes. কিভাবে তাকে কন্ট্রোল করা যায়? Usually insecticides, DDT দেওয়া হয়. Then spraying is done up to a height of 6 feet. Because those sandfly can hop, so they can hop to higher heights on the walls. So 6 feet অবধি তোমার IRS spray দেওয়া হয়, বাট তার থেকে বেশি হপ করতে পারে না. So they cannot go to much higher heights than 6 feet. So up to that the spraying is done. Also done in the cattle sheds and other places. Sandfly কে এইভাবে insecticide দিয়ে control করে. Then you can do sanitation, removal of shrubs and vegetation within 50 yards of human dwelling, location of cattle sheds and poultry houses at a fair distance from human habitations. ক্যাটেলকে বলে যে আমরা 25 ফিট দূরে রাখতে হবে বাড়ি থেকে, এরকম বলে না, 50 ফিট দূরে রাখতে হবে. Why? Because certain types of vectors can breed there and cause vector-borne diseases. Okay? And wherever there is cracks and crevice in the walls especially, either তুমি এটাকে পাকা বাড়ি করে দাও, ঠিক আছে, you fill up the cracks on the walls and the floors. You fill up the cracks by any other means. Okay? There is many another innovative ideas called light trap, etc. But that is under studies. So mainly to control the sandfly, these measures are mainly done. ওকে, মেইনলি ইনডোর রেসিডুয়াল স্প্রেইং করা হয়, ক্যাটেল শেডে স্প্রেইং করা হয়, অ্যান্ড দি environmental modification is done and sanitation maintenance is done. So this is how you control a sandfly. ঠিক আছে? So understood sandfly? Sandfly বোঝা গেছে? First of all, it cannot fly, it hops. It looks like a mosquito. It takes blood meal, but it is not a mosquito. It causes, apart from visceral leishmaniasis, it causes cutaneous leishmaniasis, oriental sore and sandfly fever. Okay? And it prefers hot humid climate with cool shaded areas. Okay? And biting habit ki painful biting. When it bites, it is very painful. It is mainly zoophilic and it bites around midnight. But if it bites humans, then there is the disease spread. Okay? Acha. Final হচ্ছে তোমার ticks. Ticks are not at all, they do not look like any fly or mosquito. Okay? But ticks can cause very dangerous diseases. Very dangerous diseases in humans. And it is a very important problem in India. So তাই জন্য টিক্সটা আমরা আলাদা করে পড়ছি। They are oval in shape, have 4 pairs of legs and no antenna. Males are smaller than females, smaller in size than females. Heart tick ki disease করে tick typhus, Lyme disease, viral fever, then Quassionor forest disease, tularemia, encephalitis, human babesiosis. And in the soft tick, it is only one disease in humans, that is the relapsing fever. Now, what is the difference between hard tick and soft tick? Duto alada, obviously, because they are spreading different types of diseases. This is a hard tick, this is a soft tick. What is the difference you can see? ছবিটা অনেকটা বড়ই আছে. So any difference you can notice between the hard tick and the soft tick? So I cannot see the head in the soft tick, but this head of the capitulum that is said in the tick, that is visible in the hard tick. Okay, then there is the dorsal shield. Dorsal shield মানে একটা exoskeleton type surface that is present in the hard tick, but it is not present in the soft tick. It is because of the exoskeleton, not the dorsal shield only, that is in hard tick. যেটা নেই বলে যে টিকটা নেই সেটা হচ্ছে soft tick. Okay, understood? So these are the two main differences. Capitulum visible মানে head visible কিনা, second হচ্ছে dorsal shield is present or not. This is how you differentiate between the hard tick and the soft tick. So hard tick, male versus female, how to differentiate? As we know that male and smaller in size than the females, and what happens is the capitulum is visible, there is the dorsal shield present, and there is the large scutum. Large scutum মানে কি, এই যে dorsal shieldটা এটাই অনেকটা বড়, covering whole of their abdomen or the body. But in females, it is covering only part of their body. Okay, it is covering only part of their body. So it is a small scutum. It has a small scutum in the females. It is larger in size and it has a small scutum. By this, you can differentiate between the male and the female hard tick. ঠিক আছে? Finally, soft tick. It is looking like this. They do not have any dorsal shield. They do not have any capitulum visible from the dorsal surface, because of the ventral surface. What is there? The ventral surface এ তখন হেডটা দেখতে পাওয়া যায়. Otherwise, these soft ticks cannot be seen. Okay? So these are the features usually of the hard tick and the soft tick. Understood? যদি difference আসে কোনো এক্সামে জিজ্ঞাসা করে, you should be able to tell. And the diseases that is there, that is difference between hard tick and soft tick, it is very important question in your exam again. So কি diseases cause করে, what are the difference in their anatomy? Okay, so these things need to be known.